Okay, well today we're going to talk a little bit about Ultherapy. If you saw some of the videos earlier that I've shot, we were talking about the thirds of the face. So we're breaking the face up into horizontal thirds. So the top third, we talked a little bit about Botox and neurotoxins like Dysport, Botox, Xeomin. The middle third, we talked a little bit about fillers. When we get into the lower third, which is the lower third of your face, which include the jowling and the extra neck skin and platysma bands, there's really only a couple different modalities that will actually treat that area, and the best non-invasive device we believe is Ultherapy, and this is our Ultherapy machine. When you go to minimally invasive devices, we use a ThermiTight machine, and if you want to go to full surgery, that's a lower facelift, neck lift. But today we're going to focus on non-invasive machines, or non-invasive ways of improving the lower third of your face, and that includes Ultherapy. Ultherapy is an ultrasound. That's where the Ultherapy comes from. It's an ultrasound. Two different wavelengths of ultrasound will be shot through your skin to different depths. And if you notice, we have different transducers here, and the transducers will allow you to shoot those wavelengths through your skin, through the subcutaneous fat, and into the fibrous layer, and cause an injury. So the energy that's caused by the two wavelengths of ultrasound will cause an injury at a certain depth, and as your body goes in and heals that injury, it's going to tighten and contract and cause the deposition of collagen, which is the goal of all of our facial rejuvenation processes. So today I've put on one of the transducers just so you can see. I put some gel on my arm. It's just like any other ultrasound, like if you're having a baby, where you can look. So not only does this thing allow us to see through the skin, it also allows us to target, causing that, as we talked earlier, the energy being delivered deep below your skin through the subcutaneous tissue. So right now I'm going to show you, this is the handpiece that we use, and I put on a 4.5, which is a deeper handpiece, and we just hit the button here. You can see the face, it's designed to try to treat the jowling area as well as the neck, and you can see the different areas that we do. When we put it on the scan, you'll hear the noise, and it can start scanning, and if I just put some gel on my arm, you'll start seeing the different layers. What we're doing in the 4.5 is we're usually targeting muscle. Now there's no muscle on my arm here that's going to show up at that depth, but on your face you have a muscle layer. The other thing that we target, let's turn this off so it doesn't make so much noise. The other layers that we target is the skin, because we want to get some tightening of the skin. So really what we're doing with Ultherapy is we're going after a couple different layers. If you look at, patients like to ask me, what modality is this? Is this going to be more along the laser lines, or is it radio frequency? And I always tell them, no, it's actually ultrasound. And the difference is, if you look at lasers just penetrate into the skin. So the layers of the skin, we'll make them very simple. At the top layer is going to be the epidermis, and then below that's the dermis. And there's a couple different layers of the dermis, the papillary, the reticular dermis, and then we call the subcutaneous fat, and then after that would be the muscle layer of your face. And that's the layer that we tighten in a facelift. And this ultrasound treatment, what we do is the ultrasound waves will penetrate through the skin. Now this is not the muscle, but let's pretend right where the crosshair is, which is right where this line is. It recognizes this as a 4.5 transducer, so it's going to show me a line at 4.5 millimeters depth. And so let's just pretend that that's where the muscle was, because that's about the layer of where the muscle is in your face. What'll happen is it'll send a series of pulses by those ultrasound wavelengths and give you about 20 pulse shots at that layer. What that's going to do, like we talked about, is cause an injury, and then as your body goes and heals it over the next 6 months, it's going to cause tightening. Now, CO2 laser and all those other lasers like erbium laser, Fraxel, all those lasers only really penetrate into the skin or into the dermis. That's as deep as they will go. This can actually go through the dermis without injuring the skin and go all the way down to where the muscle layer is. Now that's with the deeper transducers. Now we have more superficial transducers. We have a 3.0, and then we also have a 1.5. 1.5 is in millimeters. You're talking a really, really small amount underneath the skin, and it really is only hitting the dermis. So with this same device, we can actually target not only the dermis to cause an injury that'll that'll tighten in time, but we also shoot all the way down almost to the muscle layer, which causes the injury. And as time goes on and your body lays down the collagen, and the collagen goes through cross-linking and tightening, that's what's going to give you the rejuvenation that you're looking for in the lower third of your neck.